So, good morning. Thanks for taking me for an interview. My name is Dr. Nidal El Baridi, and I am an anesthesiologist by training with a subspecialty in interventional pain, neuroscience, and orthopedic pain management. My office is in Chicago, Illinois, and I am intricately involved. Maybe it's better if I take this off. And I'm intricately involved in managing the current crisis from two different perspectives. I concurrently practice in an inpatient setting as an anesthesiologist and also in an outpatient setting as a surgeon, taking care of people who have chronic needs related to dysfunction of pain, related to nerve and orthopedic issue. When this pandemic started, I've seen a need to jump in and not only help others, but really just step up to the level of a physician and provide my assistance whenever it was needed. The assistance came from me volunteering at helping organize the new McCormick Hospital, which is one of the triage centers in Chicago that has been very nicely prepared by our governor, who has had a very good foresight, and in conjunction with the city officials, Lori, the Chicago mayor, have created this center which could potentially help deflect the influx of suspected COVID cases that are not sick enough to be in the hospital, but are not well enough to stay at home. Mm-hmm. And then at the same time, I have saw a need on an outpatient basis. I was approached by a group of well-meaning citizens who have, on their own accord, 2 weeks ago, when there was this initial shock from people all of a sudden finding these terms about PPE and ventilator and virus. There was so much nebulous information that has circulated that have really put not only a lot of fear into people's minds, but also has shut down our infrastructure within the city. And the very first response that us as physicians have had, why can't we assist other first responders in the city, police officers, firemen, emergency medical technicians, bus drivers, and offer them an opportunity to get more information about this. The aspect of this novel virus, this novel disease, is that really no one knows how to treat it. There are some speculations where this came from. There are conspiracy theories. There's a lot of misinformation in the public that comes from not having a unified information source that everyone follows. So as a physician, I have really kind of stepped down to the very basics of our training. And then most of us have, depending upon our specialty, either have a society with which to whom we belong, or they have an other means of getting a credible amount of information. Well, you know, if you want to boil down to the very bare bones, the very first effort has been done by the World Health Organization, the WHO. And I know that WHO has some bad press right now that is being put forward, but I think that is very, very unfair. And then, of course, there is the Centers for Disease Control in the United States, which manages this pandemic and outbreak on a global level in our country. And then on a local level, each state has their Department of Professional Health and Regulations. In Illinois, this is called the IDPHR. So armed with that information, I chose to follow the guidelines put by the society that I belong to, the CDC and the IDPHR, or Illinois Department of Health and Professional Regulations. So in an outpatient setting, we have been able to open our phone lines and open our facility to people who were just seeking information, but more so people who were really in that critical group that required testing. The testing aspect of this is something that, you know, it's still not clear to a lot of people, and what has to be understood is that The testing is something that connects all of the medical professions in such a way that allows for the most needy to be given a test that is necessary that could lead to the corrective treatment. So the CDC and IDPHR have jointly published set of guidelines that we physicians, no matter which specialty, follow. And these guidelines are categorized in 3, sometimes 4 categories. And these categories are as follows. Category 1, this pertains to the testing, are people who are critically ill, people who are hospitalized, people in nursing homes who actually have physical manifestation of these symptoms. Because this particular disease has a predilection for elderly or people who have what's called comorbidities, the term which describes people who have underlying condition which they are aware of, such as diabetes, heart-related issues, endocrine-related issues, brain problems, and so forth, to people who are actually asymptomatic or who have an underlying condition, but they just don't know about it. And then, so categorization of these groups is very, very important. So the category 2 are actually people who are in a first line of helping others. The idea behind it is that if you deplete the system of the healthcare workers as much as the available resources, then there is really no one to take care of in an organized way the sheer public that could potentially get en masse sick. So most people that would call would actually fall within the category 3, which are people that are asymptomatic or have mild symptoms that are prevalent, that are appearing. So somebody has a runny nose, maybe a watery eyes, a little bit of stomachache, and so forth. And in the 4th category, people that have none of those things, people that appear to be healthy, that are that don't have any manifestations of any underlying medical condition. So imagine if you are afraid and you fall within the 4th category and there are only limited amount of testing abilities available, then we have to triage and prioritize this. And that prioritization is exactly why there's a lot of misinformation that circulates out there. The numbers which are now shown are showing a very minute percentage of the US population that has quote unquote shown the disease. But if you actually look at this on a more microscopic level, you have to appreciate that based on this triage classification, we have really tested people that are sick. So if you have such a strong symptom, or if you're an elderly person, you're 80 years old, we are going to, of course, provide you the care that you need. This is what triaging in essence means. We're providing the good care. The interesting part is that the good care that we can potentially provide at this point is the care that is based on what's called supportive measures. So these supportive measures are essentially things that are allowing us as physicians to maintain someone's life. We can maintain circulatory system, we can maintain basically blood flow, breathing system, and so forth. Of the people that have been tested, the people who have become positive, if you look at the charts, which are published by the CDC and by the global IDPH resources, which basically collects the data from all of the centers in Illinois, there's about 1/4 of the people that are tested that are sick. So the numbers are actually staggering. The numbers are much, much bigger. They're not 0.1%. The numbers are probably 25 to 30%. So imagine if you're walking around the street and most of us have not been tested. We have, of the people that were sick and showing manifestations, the people that were falling within those 1 or 2 categories, sometimes a 3rd category, 1/4 of the people are ill, or rather 1/4 of the people have this disease that we don't know how to treat except with supportive measures. So that is the reason for social distancing. I think that United States and the world as a whole has really come to a screeching stop. And something very interesting is happening. In the past, our impatience to get a test, patient coming in and say, I want an MRI, I want an X-ray, is really quailed down to 0. Everybody's patient now. not only that he's patient, but understands that the complexity of being able to offer this test is now put forth to a different dimension. And what it does is it brings a very interesting point that the availability of the resources that are in front of us right now are limited. And these resources is one of the reasons that we as healthcare workers are pushing forward for this stay-at-home ban. Because once the availability of the testing capacity is in front of us, and as the disease has progressed, we have actually been able to, myself particular, but the pharmaceutical companies and people who are in the forefront of discovering and testing this disease have come up with a much quicker and much more efficient solution than what we have right now. An interesting thing will happen. We will have multiple abilities to test the population, and they will have a very large number of positive people. So then the question will become, how are we going to treat this? How are we going to appropriate care? And when this comes, and it will come in the next 2 to 3 weeks, the next question is going to be, where's the vaccine? How are we going to actually provide, quote unquote, cure for this dreaded disease? That's something that is yet to be found. We don't know that.
Sorry. Do you recommend regular people wearing masks?
I do. And I mean, I wear a mask myself whenever I'm not outside of the house. The reason for wearing a mask is very, very simple. This mask right here is a mask that provides a small amount of shield barrier for large particles. The membrane on this mask is significantly thinner and more porous than the membrane on what's called an N95 respirator, for example. Everyone has heard of this term N95. And what that essentially means is that the quality of the membrane filters 95% of anything could potentially penetrate through here, which means that it leaves a very small amount of air to come to a person's face. I actually happen to have what an N95 mask respirator looks like, so I'll bring it here just for 1 second. So this particular mask, the N95 respirator, has a clarification over here which talks about the protective nature of this. Viral particles are very, very small, whereas other particles, dust and so forth, are bigger. So this particular mask, the filtering aspect of it, is what actually provides the protection against it. If you are running outside, if you're walking outside and there is strong wind, you may be 6 feet away from another person. But if the wind blows in your direction, the aerosolized particles of someone coughing or breathing in a completely opposite part of the street even would come towards you. Obviously, if there is no wind, if it's sunny on the outside and you are 6 feet away from somebody and you don't plan on being around anyone else, then I suppose an argument can be made that no, you don't need to wear a mask. But if you're in a closed, congested area, much like us who live in Chicago, or people that interact in healthcare establishments, or you're in an elevator, on a closed car, you're riding in an Uber, you really should be wearing a mask, not only for the purposes of an immediate contact with a person, but more and more we find about this virus, we're acknowledging the fact that the aerosolized particles are so light. Obviously, feather is very light. I mean, I don't know if I can make an analysis in comparison of something else, but the light nature of a particle that is in the air may just linger in a closed space, such as an Uber or so forth. So short answer to your question is wear a mask.
Gotcha. With that being said, you mentioned the McCormick, hospital that was built, and McCormick is actually a convention center. It's not.
Correct.
It was.
Yes.
Do you see that space filling up? A lot of people are wondering if there's a need for the space itself.
So that's a very good question. I think that the aspect of being a good medical provider, and which is why our healthcare cost, in essence, is sometimes considered very high, is because preparing and being on the forefront of anticipating what could come next is what constitutes good medical care. So to answer the question of an unknown is very difficult. I can speculate and I can say that this facility hopefully will not get busy if we follow the direction from the governor. But consider the fact that if the directions are not followed and then there's an escalation of a number of cases which are confirmed, then yes, this facility will actually become most likely an overflow. The if and I can share this data with the public and on your website later, but all of us physicians have the ability to sign up with daily updates and sometimes multiple times a day from CDC and Illinois Department of Health. This is actually a public information. We just get a digested version of that. And you could see a staggering number of cases that are appearing to go higher. For example, if you look at the data which came in from the March 25th and today, April 19th, we have had something about maybe 2,000 or 3,000 cases in March 25th. And now we have 10 times the amount of that. So what that means is that there was not necessarily a progression of the disease. It's just that we started recognizing and testing more and more people. And we're essentially, it's kind of like shooting fish in a barrel, for the lack of better terms. There's a lot of people whose immune system was able to overcome this. And these people have a stronger system, if you will. We don't know who these people are. We can anticipate. Probably you are. I'm hoping that I am. But none of us are impermeable because we don't know the true nature of this disease. So what will come of McCormick Place is yet to be determined based on the efforts that the governor and the mayor's office are putting forth, which, as I mentioned earlier, are monumental and really, really beneficial for our state.
Got it. There has been talk in the media and the internet about, anti-malaria drugs being used to treat COVID. Do you have any perspective on that?
I do. So in order for a medication to be released to the public, a medication has to go through a certain amount of trial. Let's take aspirin, for example. Function of an aspirin is to provide blood clot in somebody who has had, for example, a heart disease. But an untoward effect of that is that it can actually cause excessive bleeding in somebody, which can then cause multiples of other things. The least benign of these bleedings could be erosion of the gastric lining. So whenever you take an aspirin and your intended use is to have a unblockage of your small arteries in your heart, which is what a lot of people are familiar with, you have to accept the fact that in a very small percentage of the patients, there is a potential for gastric lining injury and bleeding. So similarly to that, if we were to give a medication to somebody such as hydroxychloroquine sulfate, which is, as you say, an anti-malarial drug, the intended use for this medicine is to stabilize the hemoglobin and to prevent the malaria itself from destroying the actual circulatory system of a person. But the side effects of this drug are so great that we have to be really careful to whom we give it. So coming to a physician in the United States of America, if you have an ailment, you'll go through proper medication reconciliation, proper history taking, and so forth. And then you prescribe a medication that will have more benefit and very little side effect. And then through the follow-up visits and constant monitoring, you assume that this drug is the good drug for the patient, and therefore the patient continues short or long-term course. But in the case of Plaquenil, which is the brand name of the drug, or hydroxychloroquine sulfate, this medicine, we don't know what it will do to a person who has an underlying cardiac condition, an underlying pulmonary condition, which is what COVID eventually leads to. So we could be treating the virus, but the side effect of this medication is so great that the after effect of maybe a year or 2 years now, provided the person survives the initial insult, could be just catastrophic. I often like to bring a comparison in somebody who actually has done a little bit of reading about medications in general. There is a drug which was actually very popular in 1960s and 70s called thalidomide. And if you've ever seen an unfortunate person, a young a child or an elder adult at this point who has really small limbs, they call them flipper babies. They would have maybe like one finger sticking out of the arm, or a very short limbs, or obviously inability to walk and so forth. Those are birth defects, which were actually caused by a drug called thalidomide, which was given in a good nature attempt to help women in 1960s and 70s prevent nausea and vomiting. So imagine if you're an obstetrician in 1960s, 70s, and there's a pharmaceutical company that says, we've tested this drug, this is great, here's a medication, take it. And of course, an unsuspecting customer takes that medication, customer being the pregnant woman, nausea is gone, it's perfect. 5 months later, when the baby comes out, baby has one finger sticking out where the arm should be. That particular case has obviously caused such strict guidelines in FDA and medicine, because imagine a physician who would actually consider himself not only liable for that, but imagine a pharmaceutical company or any normal human being that would induce a change like that in another person. For that particular reason, I advise obviously not en masse administration of hydroxychloroquine, but a careful examination by a physician who has actually looked at all the aspects of this and not just prophylactically limit this medication. Similarly to that, the same concept can be applied for the vaccine. Can the vaccine be available right now? Most likely, yes. But if you take the very example of thalidomide as a drug, we really do not know what this medication what this vaccine could potentially cause down the road.
Got it. Thank you so much, Dr. Nidal. My last question for you is, with everything, that's happening right now, a lot of people, are worried. There's a lot of, fear. You mentioned earlier, there's a lot of misinformation, going on. What message do you have, for people at this time? Because if you turn on the news, you turn on the internet, it's very scary. But from someone who is an accomplished physician and is also dealing with COVID-19 on the front lines, what is your message to the general public?
It's very simple. If you trust your physician when you have a broken leg, if you trust your physician when you have a heart that has an ailment and you need medication for your heart, if you trust your physician to give you medication for diabetes, and then if you trust that the state regulators are working in your best interest, no matter what the political party is, then I think you owe to yourself an opportunity to trust the guidance by the state representatives and by the federal representatives for that matter, because we physicians are in direct communication with our state leaders from the mayor's office, as well as from the governor's office, and then downstream from that. So my advice is, prevent us from reaching a point where we would have to be in a very precarious situation, where a person would come in through the doors and we would not have enough medical staff to counteract this issue. You have to remember that the amount of medical staff that is available right now has been closely matched to the need of the population. That's why there are a limited number of spots in a medical school, in a nursing school, in respiratory therapy school, and so forth. If we overproduce, obviously these people will not have a job in a normal situation. But because nobody anticipated a pandemic, and this was clearly not well prepared, then we're having an issue. We could potentially have an issue with just us having to make a decision on a spot that would cross all ethical boundaries, which is what has happened in Italy, where we say, you're old, you have a cardiac disease, therefore we're not going to treat you. We're going to treat the 30-year-old who has a broken ankle, for example, in this respiratory issue. I'm pretty sure that you would not want your loved ones, your grandmother, your grandfather, or your elderly parent who has a cardiac condition be left out in a stretcher in a hallway. This is what would make our country less great again, if you will. And part of my advice is, outside of following the guidelines by the mayor's office and by the governor's office, wear a mask. Even if it's a makeshift mask, unless you can get hold of something like this, so an N95 respirator versus this. The number one thing is wash your hands. Use any kind of a sanitizer. A sanitizer can be a solution that has about 70% of an isopropyl alcohol, that it has a little bit of boiled water in it, and it has some sort of an emollient. An emollient is that nice feeling that when you sanitize your hands, you have not a feeling of dryness, which is what alcohol, if it's used in a pure form, would do. And then, of course, practice good hygiene overall. In our culture, in our society, we leave our shoes at the front door. We wash our hands when we walk inside the house. We leave our clothes and then dispose of them and get inside the house with normal house clothes, if you will. And I think that, in my mind, we have been sort of prepared for this from, 1,500 years ago. But to other people to whom this was not perhaps obvious in the past, these clear sanitary guidelines that are embedded into our fabric and our culture from the time that we were born are really coming to light now, and the importance of them is critical. So spread the good word, wear a mask, hygiene, and listen. Be trusting and be loving to your neighbor, which is what I think that we all need at this point.
Absolutely. Thank you so much. I do have one last part that I want to talk to you about. You mentioned culture, and you mentioned our culture. Can you tell us a little bit what you mean by that, and what's your cultural background?
So I'm a proud Syrian, and I am obviously one of the many Syrian member community in Chicago here in the United States, who have been on the forefront of this through the efforts that we only provide to the local community, but also to the communities throughout the world. So there are many organizations that are promoting obviously global efforts and efforts on the microcosm level of Chicago. But I think that helping our families who are in other parts of the world, and then helping our global Muslim community throughout the entire United States is very, very important at this point. So at the end of the day, I always like to leave my thoughts at the end of the day. Love is love, and kindness is kindness. And as long as we as humans can be seen and portray what we do as a good deed, I think that we will live the covenants of our faith and covenants of our lives. And that's pretty much all I have to say about that.
Absolutely. Thank you so much. I know I keep always, saying this is the last question, but I randomly was looking online and just looking at the origin of the word quarantine, and it turns out that it was came from Ibn Sina, who's a Muslim, physician, and it came after him quarantining, people that were suffering from leprosy. So even that part of history was just very fascinating, you know, to find out.
Indeed.
Hmm. Hmm. Well, thank
Well,
you so much.
no, please
I'm
go.
sorry. Go ahead. No, go ahead.
No, I just want to say thank you for the opportunity. And I actually have to go and help one of those in need patients.
Absolutely. Well, thank you so much for everything that you're doing for our community, and please be safe out there. And our hearts are with you and all of our first responders, and we're praying for you all.
Sure. And just so that you understand the context in which this interview is conducted, the outpatient clinic to which I am a part of, we are a surgery center that helps people who have chronic pain-related ailments, as I mentioned at the beginning of an interview. And the reason we're open is because as a medical office and as a critical service, we are in the same way trying to deflect people from untoward reasons going towards emergency rooms. If you remember, prior to this epidemic, there was a whole slew of patients that were coming in for a true medical related issues. So now that the sanitary guidelines and the constriction guidelines have to be followed, just think conceptually, adding yet another burden of en masse people into a mix of people who already need medical care. So providing pain relief in that aspect is a critical and essential point for people as long as we follow guidelines. And that's exactly what we do. We take selected few patients who are in need of certain pain relieving mechanisms, and then we offer them on one-on-one basis, if you will.
Got it. Well, thank you so much, Dr. Nidal, you know, for joining us and for all the work, you know, that you do. And we're looking forward to having you again
Thank you.
on Mala.
Okay. Assalamu alaikum. Thank you.
So.